Video we're going to do a video on plantar fasciitis. So that plantar fasciitis at the bottom of our foot. So remember, at the calcaneal tendon is pretty much where the bigger portion of that ligament rests. So think of these two fingers, and then it keeps traveling on up, and then it separates into the 5 different ligaments going to your toes. So if our client curled her feet in or made it like a monkey grip or a foot fist, right? So those 5 different ligaments is 1, 2, 3, 4, and 5. They all kind of separate up here, but then they all come back together down here as one big ligament. So this ligament is pretty tough to work on, especially if you're an athlete and you've suffered from this condition before. It's very painful. It causes you not to even put pressure on your foot. Even if I pushed in like here and a client moved off the table or jumped off the table, that's pretty bad. They need an injection. So a podiatrist would have to shoot a needle inside the foot to calm everything down, to get out all the nasty inflammation or inflammation that's hurting or pressing on the nerves or that ripped calcaneal tendon. It's pretty much separated. So the calcaneal tendon back here comes all the way down, plantar fasciitis, or the plantar side of it. Remember your foot, plantar, and comes down in the middle. It breaks either in the middle or back here. If you have a rip back here, it's the worst, because remember, this is the thicker part of it. But if you have a rip up here, it heals a little bit better. It's not so much painful. But if you have a high arch, of course it's going to be painful, because that arch, every time you flatten the foot, yeah, it's stretching even more, and it's very, very painful. So if you have a flat foot, you're well off. You're going to be better in recovery time. So what do we do for plantar fasciitis? We're going to warm up the foot. We're going to use some cream, just a little bit. Make sure your hands are warm. You don't want to have cold fingers. And warming up your client's foot. I think I have cold fingers.
Warming in my foot.
So we're just buttering up the bread. We're pretty much just adding lubrication to the foot. Okay, now that the foot is nice and lubricated, you can go ahead and give somebody a good foot massage just to open up, like a pin and stretch. You're pinning your thumbs to the client, stretching that plantar fasciitis or the ligament. Not too hard, but if the client can take it, you want to stretch out this part up here and then work in to the foot, because now it's, as you can see, hers right here, this is perfect. So right now it's at normal, but then when you hyperextend, her ligament pops right on out, this thick connective band of connective tissue, or ligament, more than connective tissue, thick. And so you just do some thumbs, circle, get on in there. And so from this angle, you guys really can't see, so we're going to work on the opposite foot, okay? I don't know why I'm saying okay. To edit that out. All right, so once again, lotion or cream. And I know what you're thinking, that's a lot of cream. Me, I like the foot slippery. Almost to where it's like a fish up in water, you just lose the fish because it's too slimy or slippery. That's okay. You'll see in just a moment. Now notice how her feet are nice and elevated. Normally if you took this away, the foot would be way down here. I have to lean over the foot, but here it's shoulder width or elevated to my shoulder, so I don't have to worry about bending over and messing around. So again, this hand goes forward. So see how her ligament pops right on out. It's the only way you're going to get this to pop out. So imagine this getting tore or ripped. right, it'd be very, very painful. Because this is painful if I stripped on in here, like right on the foot. To some people it feels good, but if you really get in there, it kind of hurts. But it's like a good hurt. So that's the tendon that we're going to try to work on. All right, so just like your thenar eminence or the flexor pollex muscle, you know, like your politicking, when your thumbs up, hey, everybody's giving that thumbs up when you're politicking. That's that big muscle right in here, your thenar eminence, your politician muscle, basically. But we don't really call it that. Just if you're in school, you'll pass your test if you just remember the flexor pollex muscle. You will pass your test. So we're rubbing in here just to break up any scar tissue. Because remember, when you do have the plantar fasciitis, over time, it gets jumbled up just like a fist. So it starts to close and close and close and close and close and close and close. Because that ligament, all ligaments want to heal tighter than what they began with or before they were ripped. When they were nice and normal, it was just nice and loosey-goosey. But when they heal, it heals harder. So what I mean by that, it's just going to keep closing down, closing down. So what we need to do is stretch out that foot and loosen it back up. Because if it's so tight to where you're stepping down, it's like you're still feeling pain. That's because it's so tight to where loosening up, the muscle does not want to recognize what you're doing. So it's going to cause you trauma or pain. So what we have to do is break up these fibers because they've healed too much. Say if somebody has a scar on their foot or a keloid, that means you have good skin production. Your epithelial cells or squamous cells, all that good stuff, it healed too much. And that's when you get a big lump or a scar. It means it's just you have a lot of scar tissue that went to that area and healed rather quickly or too much. Same thing for a ligament down here. So when you see somebody's foot at the bottom, when they have like a little ball on their foot, it healed way too much. You have to actually get that removed, or a podiatrist has to cut that out, because you're going to keep feeling pain the rest of your life. Even though it's healed, it's still not. It's like a speed bump in your foot. So if you drive down the road like every 5 miles, it's a speed bump. If you can imagine that every day, it's crazy. So what are some of the tricks that we do to actually save our hands? And actually, before we go into cupping, we go into the traditional methods of Thailand. So the Thai, like Thai massage, they have a Thai stick. So the Thai stick, you pretty much can dig onto the foot. You can stretch the foot out and dig in hard as you want if you want to, or you can just start out nice and light. And you should feel popping or clicking. Now remember, use a little bit of pressure, but not too much, because this instrument, it doesn't have fillings. So your foot has fillings, but if you keep grinding too much, it can start to hurt. And this is why I have it nice and lubricated up, because if it's just bare skin, it actually could pull. It causes more pain than anything. It starts to hurt. My fingers cramping. Jesus. I'm having a hard time. Okay. So your little end of the stick is more detailed work, but it's also going to cause you the most pain. Right? See how she just jumped? And that was just a little bit of, this thing is no joke. That's why I use the bigger head. The bigger head gives you a little bit more control. Now see, when I began, right here was a little bit hard, but now it's nice and soft. Back here is still a little tough, so let's work the lower area. And all you're doing is introducing that blood flow. Back here, blood really doesn't flow too much underneath the foot because we're always plantar side, or we're planting our foot down, it's always being pressed on. So if nerve endings were really superficially at the bottom, we really couldn't step on anything because we would feel everything. So they're mainly in the middle of your feet. So that even when you cut the bottom of your foot, it takes a while to bleed, it just doesn't gush out. Now if you cut this side of the foot or on top of the foot, of course. But the bottoms, yes, they're gonna bleed, but not as bad because there's not too many arterial, flow through channel or points at the bottom of the foot. Oh, Jesus, I really need rest. I know, right? All right, so now that you've seen like a few things that you can do with the sticks, either you can poke in, twist, poke in, twist, poke in, twist, all the way up the foot. So if you have, just remember 3 different levels, so top, middle, ending. Never really want to go up here unless you're just doing a regular basic Thai massage with the stick. But this is plantar fasciitis. Remember, it's going to kind of stop right here. You don't have plantar fasciitis up here. It's normally always back here where it snaps from the origin to the insertion, or on the way to the insertion. So in the middle and in the end. So remember, we're here, we're jabbing on in here with the stick. It can feel a little weird because you're actually using an instrument instead of your hand. Alright, so when you guys look at the bottom of the foot, palm, brace, it removes your plantar ligament, or the ligaments of the foot, into a stretched position. So with your stick, you can go to the sides, right over the ligament, and then right at the bottom you got to switch your position, or your hand position on the stick, because you're going to use force, and really dig in there and break up any type of scar tissue. And again, you can push in on the foot, and on the foot, twist, and on the foot and twist. And it's gonna look different on a full screen anyway. The phone doesn't do it justice. So see how her bottom of her foot is nice and loose now. Some people's feet at the very bottom is like a brick, but hers, as you can see the indent on my finger, right, so see here, it's an indent, right, this is a soft heel, which is great. It flexes inward, you can see the skin pulling. Even when you're doing this on somebody's foot and it's a hard foot, you're not going to get the ridges in the foot. This is soft, this is how it's supposed to be. So our next treatment, we're going to do some cupping. So when you do the cupping, you can do manual cupping if it's, or vacuum. Take your cup, place or lubricate it first, get some lubrication on the cup or inside. Your hand should be lotioned up enough or greased up enough. Now this hold might be a little bit too much, because see how she's already starting to turn red. So we release. Right, so see that might be a little bit too much. We just check in with our client and see how they feel. And Carrie, how was that?
It was a little much.
A little too much, yeah. So again, right at the problem area. Just 2 pumps instead of 3 or 4. So see how it pulled everything on the bottom of the foot. All the skin is buckling. You can see everything like coming together. It's sucking into the foot. And this is what that calcaneal tendon needs to be brought up and broken up. So relax. So I would do this for no more than 10 minutes, maybe 15, but 10 minutes is long enough, trust me. So I rotate, I go from up, down, up, down. So up again, middle of the foot, press back.
You mean the cup stays on there 10 minutes? Or
Yes. Oh yeah. Yeah, the cup will stay on 10 minutes. Normally you can use 2 cups. I'm just using one for our purposes. So the second one would be here. And I will leave it right on there for 10 minutes. You can do 5 minutes, you can do 2 minutes, whatever you want to do, but no more than 15. Cupping is not supposed to be on your skin for more than a certain time, because then it does cause deep bruising, almost a little bit too much. Because see how red, almost like bruising right now, it's like a hickey for your foot. So how long does it take somebody to get a hickey on their neck? Literally seconds, because you are sucking on somebody's neck and you're bringing up all this little red blood flow capillaries. They're bursting. They're actually getting bruised, or they're popping out of the arterial or capillary little housing group, if you will, and now it gets stuck in the epidermis of your skin. It has no way to get back to that vein or venule or capillary. There is no way unless you flush it back in, which most people don't have a massage therapist at home after you get a hickey to flush blood flow back into your bloodstream. So see how that blood just kind of pretty much went back to where it was because I manually moved it. So again, right at the bottom. Again, you release. This is just for our purposes only. I'm doing it fast, but I will leave both of these cups. Okay. All right, so we're gonna light our fire. Let me get this out the way. What is it here? Put your cup down. Get your lighter. It's too much?
No, it's not. It's sticky.
Okay. So now that we've worked on this foot over here, the right foot, we're going to work on the left foot. So left foot, we saturated our cotton ball. Get your fire, light it. Cup.
With the glass cups, do you always have to move them, or would you ever leave them?
Oh, you can definitely leave them. That's another outstanding question. So if I left it, it would just be right there. Is that too much?
No,
That's good.
that feels better than the plastic.
All right. So you can leave these cups here, let that fascia release, let the ligament release. The only reason why I'm moving them, because I like to get everywhere, you know, so it gets released. So think of it as you're trying to scratch something. So when you scratch something, you say it's a couple bumps. You don't want to just scratch this one bump. There's like 5 other bumps that need to be itched as well. I know it's a kind of a bad analogy, but because we don't want to itch bumps, you know, we want to leave them alone. But this bump is like the big bump to where it's like it needs to be scratched different places, and that's why I'm moving it up and down, up and down, up and down, breaking it up, making sure I relieve the pain or the itch in all the places, not just one. Too much?
No.
Okay.
You hear crunchies?
I can do it really. Okay, let's see if I can get a hard one. Get your crunchies. There we go. No, it's just in that foot. I don't know why. Grab it in my hand. Wasn't quick enough, that's why. So it's got a and it wasn't too hot.
No.
Okay.
Well, one time it was, but it wasn't bad.
This is it. Okay. I did this foot. And cup it hot. All right, so if you want to get away from the fire, just get your silicone cups, get a little bit of lubrication, and the inside of the cup as well. So we stretch that foot back. We place our cup on the foot, make sure there's no air. Squeeze, but that's a light squeeze, so I'm gonna do it a little bit harder to really get that cup in there. Now we're on there. And this cup is a little big, so let's go to a smaller cup. Smaller cup.
Low battery. Low battery.
Oh, okay. We're almost done. So the little smaller cup, you leave it there. Get another smaller cup. And these cups are good, so if you had some water or you're in a pool, you would do a therapy in the water, a hydrotherapy treatment, to where these are still sucking underwater, and it gets more pressure actually, because water, you're submerged, and these get tighter because the air is trying to escape or push in. Sort of how a submarine, if submarine gets some sort of hull or wall damage, everything on the inside is going to cave in like a beer can or a soda can. Same thing for here. If you go into water, it's going to start to even give you more pressure and press in. So see how tough these are when you press in? Comes right on off. Man, like face huggers, like in the movie, Alien. Very, very tough. So again, flatten out that foot. If you can get a good grip around it, just twist and move upwards. Lost my hair. Jesus. Twist, twist, twist. I didn't lubricate my cups, that's why. And then pull down. So again, grab and pull down. So all you're doing is trying to suck this ligament this way. Instead of it being flexed and hurting all the time, we want to suck it this way, so now the good blood can rush in and heal and do its job. Without good blood flow, injuries cannot heal, or if they do heal, they take forever. They take a long time, weeks, months, years. That's a long time. So now what we're doing here is we're raising our skin, blood, tissue, ligaments, everything off the bone to where it's like free flowing. Now that blood can now rush into those pockets or areas to start healing. When you get injuries, you have bad stagnated blood or inflammation. So we want to get rid of this inflammation and flush it out. After 3 days of that injury, it should be gone. But now you need to start the healing process. The healing process is you actually manually massaging with your thumbs, fire, silicone cups, and moving around that bad blood or stagnant blood and allowing that new blood to rush in and to heal. New blood can't really heal unless there's some sort of free passage or a way to heal. So now that her calcaneal tendon is nice and loose, this is what we need. This is the ligament. Yep, we're doing good. So you can take both of those thumbs, dig right at the point of origin, and go right on up. It'll be a little bit of pain. And you go all the way up. And bend those toes back. Now right here where those toes are bent back, if they start screaming or hurting, then this is still ripped. But this is how you really figure out, like, okay, man, let's see if they're healing. I'm digging in. Like, you can see the white tips of my thumbnails. When you get home, or you're recovering from your plantar fasciitis, or anything that's underneath your foot that's causing you pain, this is not just only for plantar fasciitis. It's good to loosen up the bottom of the foot and to get some relief to sore, tired feet. Our feet are neglected all the time. So what we need to do is have tools or home self-care where your husband's not going to do it, your girlfriend's not going to do it, then you got to do it yourself. So the nice rolling massage tool is just a foot roller. You're just rolling back and forth, back and forth, and you're really getting underneath that plantar side of the foot. And see how it's just your range of motion. You can get everywhere, all the way from the back to the side, wherever you want to go, you can do it. And so it's just a great, it's just a great thing to do if you have plantar fasciitis or your feet are tight underneath. So if you go to the sides, you can see underneath it gets your calcaneal tendon, the origin of the plantar fasciitis or the fascia ligament. Then it gets to the heel, or not heel but arch, and then underneath the foot. And this is really, really good at home, so when you can do it yourself, and you can add as much body weight to it as you want without having somebody rub your feet. You can rub your own feet. So the other tool, if you need something harder, would be a wooden tool. The wooden tool is pretty much stationary. So when you are stationary, you can just press down on the foot, just press up, press back down. So you're just going up and down, up and down. And you can glide back and forth. Fourth will be a little bit better because back it kind of makes it flip over. So I normally just go like in a forward motion. There you go. And this is a little bit harder. This is what some people need because they have brick feet, or their feet are just cement, steel, or whatever. They have a bare foot. So they have to pretty much get some sort of penetration, and this gives you the perfect penetration. It's just a wooden tool.
Is totally naked. We're going to use the male model for now because they don't have a female version of the model, but that's okay. So let's flip him over like he's laying down, supine. Alright, so he's supine on the table, right? So let's take off some skin and look what's underneath the foot. Take off some more. That's the subcutaneous layer, our fatty layer of our feet or body. I'm going to take off another layer. So now we have the skeleton or the skeletal system. So in the video we worked on both feet, but for now we're going to start off on the right foot. So the right foot we're going to zoom in on. That should be good. So right now we're just looking at the bony landmarks, or the bones where everything connects to. So if we add in some connective tissue and some muscle, this is what it would look like. So remember, we're talking about plantar fasciitis, the fascia that's superficial to the skin that gets ripped during athletic activities or a strenuous or fast activity, or stepping on something very, very hard and ripping at the calcaneal tendon or the calcaneal bone as well, and it reaches all the way to the first, second, third, fourth, and fifth tarsals, metatarsals. So again, so we add some connective tissue. So right here, as you can see, this is part of the ligament. This is a deep ligament though, very deep. If you tear a ligament at this level, you're in serious trouble. You actually need surgery, medical attention immediately. This is the
long plantar ligament.
Plantar, or the long plantar ligament. So the long plantar ligament, let me show you how thin it is and how close it is to your bone. So when you're looking at this ligament, let's say we go even further down or to the side. When you zoom in at the foot, see how close that is to the bone? If you injure that ligament, that's terrible pain. That means you stabbed your foot, you stumped your foot on something very sharp, and that you would definitely have to go to the hospital for. So that's how close it is to the bone, as you can see here. See, it's highlighted in green. Let's shrink it up, and let's go back to our original position. Alright, so looking at the bottom of the foot, let's go to our plantar fasciitis is what we're talking about. So you were just adding on more ligaments, more connective tissue, and right there, there's the culprit. So see how that lies so superficial to the foot, because if we flip it on that side again, or the lateral side of our foot, and we look in, it is very superficial to the ground. It's like the last part before the skin. So it's like the second layer, fascial layer. It encases and wraps the muscle. So right in between this connective band, the green band right here, and the green band right here, in between this little space in here, so the space that I'm talking about, let me show you, it's right in here, this space, all up in here. This is where your muscles are going to go. So if we add muscle, there we are. So these are the muscles of the foot and the whole body actually. So we're going to go ahead and flip it on around and look at the bottom of our foot. So we added all the layers of the muscular system to the bones. So looking underneath, you have right here your plantar aponeurosis.
Plantar aponeurosis. Plantar
The
aponeurosis.
plantar aponeurosis, basically what it says right here in the info block, the plantar aponeurosis is thick connective tissue which supports the arch of the foot. It connects the tuberosity of the calcaneus to the heads of the metatarsal bones. The aponeurosis is the central part of the fascia. Digital slips extend to the metatarsals. Plantar fasciitis is a painful condition that can result due to inflammation of this fascia. So it's very, very sensitive, problematic condition. So if I draw back here, so say you rip right here, this rippage, you got major problems. Because remember, it rips at that calcaneal tendon right back here. So let's undo. Let's get rid of that. So right underneath the muscles is the fascia. So we outline it again so you can see everything. So remember, they attach to all 5 metatarsals. Remember, up here, up here, up here, up here, and here. That's where they're hooking into. They all meet right in here. So what is the action of this plantar fasciitis, or the muscle that supports the plantar fasciitis? So let's see. So we click on the plantar fasciitis, and we want to get rid of it. So now underneath it, remember, we have these muscles right here. Remember these 4, the flexor digitorum brevis, they click on to or attach to the 4th, 3rd, 2nd, and 1st. Actually, I have that backwards. It's going to go ahead and be the 5th, 4th, 3rd, and 2nd metatarsal. The first one is going to be your big toe. So that's this one right here. This is the 1st metatarsal, or the big toe, the 1st toe. So then all 4 will highlight again. What is the action of it? We're going to see right now. Right, so it does that monkey grip. So it grips the ground, or grips your foot. And that's exactly what it does. So those muscles, they form into a tendon, because remember, tendons are muscles that attach to bone. Ligament, like that fascia, even though we call it fascia because it's pretty much encasing the muscle, it's so flat and broad, it's a thick connective band or tissue. It's not a pure ligament, like a true ligament. But that ligament that's so close to the foot of the bone of the foot, Remember, that was that long head plantar fasciitis, and that's the one that you have to stab. It's very, very painful. If you step your foot on a nail or something, then yeah, that's the one that really gets injured. So you now know what they do. They flex the foot. So let's go back. We're going to add on that plantar fasciitis again. So remember, we highlighted it, and this is what pretty much is hurting your bottom of the foot when you hurt it on something, you did something fast or wrong. So remember, it gets ripped right in here. And that's bad. Very bad. I had plantar fasciitis. When it gets so bad to where you can't even step on your foot, then you need to see a podiatrist immediately. So let's